Dr. Geeta, please start.
Yes, ma'am. Shall we wait or we'll start?
No, we'll start. And ma'am, Rekha ma'am, kindly meanwhile, you can start the PPT also. You can check the PPT also. Ma, Geeta, please start the recording started already.
Okay. Om Dhanvantare Namaha. A very good afternoon and warm welcome to dear all Vaidyas present here. And today will be the very unique session, our 45th webinar today. Why it is unique means we are hearing from the twinning doctors. Okay. Today, first time in 45 webinars, twinning doctors are presenting today. So before starting session, I would like to request everyone to mute the mobiles to avoid the interruption in between. So before that, we'll start the session with the prayer by Dr. Kanchana. I request Dr. Kanchana to say the prayer. Grace.
Thank you, Shakuntala ma'am. Thank you, Dr. Geeta. Om Namami Dhanvantari Adidevam Surasurai Vandita Pada Padmam Loke Jararubhayam Mrityunashanam Dhataramisham Vividhaushadhinam Dhanvantari Ramanatam Sarvaroganivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Om Shanti Shanti Shanti.
Thank you, Dr. Kanchana, for the beautiful prayer. Now I request Dr. Shakuntala ma'am, our founder of RAAOUS, to brief about our RAAOUS group, ma'am. And any instructions are there regarding the group also. You can inform here in the group, ma'am, in the section.
Okay. Thank you, Dr. Geeta. Om Shri Ganeshaya Nama, Om Shri Dhanvantare Nama. I wholeheartedly welcome Dr. Rekha and Dr. Archana ma'am for this. Yeah, as Dr. Geeta said, it is a very unique webinar today. As the Leo will start the webinar with their Patya Patya. Uniqueness in this is major is Patya Patya. One thing why, because as we are seeing the medicines part in the last so many sessions, but Aharabe Aushadhi, what we usually tell to our patients and we advise. And these two have made the uniqueness in the treating the patient, cancer patient, by changing their food style totally. So they are into this Mahanasa group since so many days. They are doing the research in this related to food. So we are actually very much thankful to them, because as soon as I asked Archana ma'am for this, she is happily agreed for the webinar, and she is agreed for 2 sessions. Actually, this will be the first session what we are going through this 12th, and again we are having another session on 26th of same March. And thank you, Archana ma'am and Rekha ma'am, for this, and welcome both of you. Behalf of all our ROS team, and special welcome from our admin team, because admins are our main pillars of our team, as usually I tell. Please be on the video, ma'am. Thank you so much, ma'am. To tell about ROS team, as all we know, many times I brief about ROS team, Rudra Arbuda, Ayurveda approach under one shelter. So, Arbuda Chikitsa, how to go ahead, like, is one part of our team. Another part is what kind of thing we can do in our to enhance our knowledge is a webinar, is also one of the part. And along with that, we are conducting 2 classes in our weekly. One is especially on Mondays on yoga. We are following the Satantra Sara, Siddha Prayoga Sangraha. Each one yoga we will take, and we are discussing for 2 to 3 months, and many gurus are contributing towards their along with their experiences, and many shishya Runda will be there to ask very nice question, like approach is also important. Guru shishya sambandha happened in that part, one thing. And second is on Thursday, which is specially meant for the cancer. So actually we are tracking cancer. We have done so much of breast and other cancers, oral cancer. We have completed a pancreas cancer study. This time we have come to a unique, this one, Rukkagata Roga cancer. So we have started with Udavarta and Gulma and other, this Udara Roga. Now we are into Grahani, because which is a main basic approach to kidney, any kidney cancers. So it is already 1 year completed, still the study has not completed. We are into last this thing in. So Thursday classes are specially on this one, cancer related things, and in that we usually study general how to approach. That is the one thing. And we are other things are, we are conducting some of the educational trip. We go to other state of states, other parts of the India, and we, those who are practicing especially cancer, we sit, we'll go and see how they are doing, what they are doing. So we get knowledge, we exchange what we are learned, like all those things, we get blessings from them. And we went so many places, and wonderful places like Hyderabad. All the gurus, Surendra Sharma sir, Ramakrishna sir, Koti sir, all them have blessed us so much. So that is the thing. And next trip will be Pune. It has cancelled just because of GB syndrome. Otherwise, we would have gone and came back already. And another thing is that we are conducting awareness programs and screening camps to reach out to the public, because they don't know that cancer treatment is there in our system. So one part is to arrest cancer at the earliest. So Swasthya Rakshana is next. And other thing, that there is no connectivity in between us and public. As an Ayurvedic doctor, they should know that it is there in our system. So all the, to achieve these things, we are conducting. Yesterday only we went to Monday district, and our admins team and other team of the RAAOUS team members are, they are organizing, and our experts will go and speak about all the dinacharya, rutucharya, rutumati charya, ratri charya. So how to arrest the cancer, so how to achieve this swasthya rakshanam, and screening camp for breast, oral and cervical screening, in even prostate cancer also. So like that, we are conducting many activities in our group. This is all about our brief about our this RAAOUS activities. Anything left, Dr. Geeta?
Nothing, madam. Regarding in the group, the questionnaires, whatever they are posting, no, they should be stick on to proper this one means method of presentation should be there.
Yes,
Means
I
simply
think we
we should
will.
not write the signs and symptoms. Along with that, proper history should be mentioned. If they want any this thing clarification about the chikitsa and all, they have to mention about the brief about the all the case history and all.
Yeah,
And
I think we will mention that in our group itself.
mm,
And I welcome almost all the delegates. Without you, this webinar will not complete. And without your support, and because many things are came up in 45 in these 44 webinars, I thank one and all, and welcome again. Over to Dr. Geeta.
thank you, ma'am. Thank you once again. Now I request Dr. Geeta Jaiswal to introduce our speakers, today's speakers. Dr.
Thank you,
Geeta.
Geeta.
Mm.
Yeah, thank you, Geeta, madam. So today I'm here to introduce our two eminent speakers. See, every time, as ma'am told, we have a single brain. Now we have a two brain with so much of information, and we all are lucky to have you, ma'am, here. So Dr. Rekha AB is a BMS MD, and Dr. Archana C is a BMS and also an MSc in Food and Nutrition. So our two speakers are uh, heading the Mahanasa Multispeciality Clinic and also a Mahanasa Healthy Kitchen. They have been transforming people's life by approaching in a very healthy way, basically with the food and nutrition, Ayurveda, and changing a little of lifestyle with them. So they have 16 plus of experiences in treating metabolic, hormonal, and lifestyle disorders. They have conducted more than 200 seminars and workshops about Ayurveda diet and lifestyle at national and international level. They have trained many chefs for plant-based diet, season-based diet, and vegan diets. They have also launched Ayushi, a postnatal care services at Bangalore, and hundreds of mothers have been benefited with it. And they have come out with more than 15 food products under FSSAI, which works as a medicine. So with a very simple thing, with a very basic, having the uh, complete herbal medicinal knowledge and bringing this to the common people, they both have done wonders in the people's life. So we welcome you, ma'am, and we are eager to hear you. Over to you, Geeta, ma'am.
Thank you, Dr. Geeta Jaswal. Now I request Dr. Rekha and Dr. Archana to start the session.
Okay, I'm Dr. Archana. First of all, I would like to thank Dr. Shakuntala Patil because she invited us, even though she told we agreed very easily. Even it was a pleasure for us to get invited by her also. And also your admin team, Dr. Geeta Puttu, Dr. Kanchana, and also Dr. Shubhamangala. And even Dr. Amulya, even before joining this group, I knew her. I had spoken to her through a patient referral. I mean, all things, good things connects together. Similarly, we connected again through this group for Dr. Amulya also. And moreover, I would like to wish greetings to my sir, that is Dr. Raju sir, and also thank him also because he also taught us so many things, especially in Kaumara Bhrutya. And sir, just 5 days ಮುಂಚೆ ತಾನೇ ನಿಮ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಿದ್ವಿ. ಅವ್ರು ನಿಮ್ ಕ್ಲಾಸ್ಮೇಟ್ ಚಿಕ್ಕೇಗೌಡ ಡಾಕ್ಟರ್ ಅವ್ರು ಸಿಕ್ಕಿದ್ರು, ಅವ್ರ ಜೊತೆ ತುಂಬಾನೇ ಮಾತಾಡ್ತಾ ಇದ್ವಿ. ಹಾಗೆ ಅವ್ರು ನಿಮ್ ಬಗ್ಗೆನೂ ಹೇಳ್ತಾ ಇದ್ರು. ಸೊ ಇಟ್ ಇಸ್ ರಿಯಲಿ ಗ್ಲಾಡ್ ಟು ಸಿ ಹಿಮ್ ಆಲ್ಸೋ ಹಿಯರ್.
ಹೌದು ನೋಡಿ, ಸಾರಿ ಟು ಇಂಟರಪ್ಟ್. ಚಿಕ್ಕೇಗೌಡ ನಂಗೆ ಹೇಳಿದ್ದೆ ಈ ವಿಷಯ, ಅದ್ ನಾನು ಹೇಳಿದ್ದೆ. ಜಸ್ಟ್ ಐ ಜಾಯಿನ್ ಟು ದಿ ಕಾಲೇಜ್, ದೇ ಇಂಟರ್ನೀಸ್ ಅಂತ. ನೈಸ್ ಟು ಹಿಯರ್. ಇವರು ಥರ್ಡ್ ಮೂರನೇದು ಸೆಂಟರ್ ಇರ್ಬೇಕು ಅನ್ಸುತ್ತೆ ಅಲ್ಲ?
ಸರ್,
ಥರ್ಡ್ ಸೆಂಟರ್ ಅನ್ಸುತ್ತೆ ಅಲ್ಲಿ ಓಪನ್ ಮಾಡಿರೋದು ಕಿರ್ಲೋಸ್ಕರದಲ್ಲಿ.
ಸೆಕೆಂಡ್ ಸೆಂಟರ್ ಅದು ಮಲ್ಲೇಶ್ವರಂನ ಈ ಕಡೆಗೆ ರೀಲೊಕೇಟ್ ಮಾಡ್ಕೊಂಡ್ವಿ. ಸೆಕೆಂಡ್ ಸೆಂಟರ್.
ಓಕೆ, ನೈಸ್ ಟು ಹಿಯರ್ ವಿತ್ ಮೈ ಫ್ರೆಂಡ್ಸ್ ವಾಯ್ಸ್ ಅಲ್ಲಿ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ ಅಂತ ಹೇಳಿದ್ರು.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಓಕೆ, ಸಾರಿ ಟು ಡಿಸ್ಟರ್ಬ್ ಯು.
So first I will be starting with the approach, and then Dr. Rekha will continue with the case study, and we will end it here with the approach and case study. And in the next, that is March 26th session, in that session it will be completely about the patya, that is the diet. How do we go with that? So I'll just share my screen. Is it visible?
Yes, doctor.
Yes, it's visible.
Okay. So the topic is unique approach to treat cancer. Actually, all being the doctors, we all have our own uniqueness in treating the cancer. So rather than general unique, we could tell from Mahanasa, that is our uniqueness, how do we approach this cancer? Initially, when we speak about the cancer, first thing it comes is, what is the cancer? We all know it is an abnormal cell growth. It is a tumor with a benign or a malignant. And of course, in leukemia, there will not be a tumor. But beyond this also, cancer in the patient's side of, patient's view, it is a life-changing event. It is a complete life-changing event where complete health is controlled by this cancer. The patient's health is controlled by them, and they cannot expect. It is an unexpectation of journey from diagnosis to recovery. It is completely unexpected. They cannot expect anything. They completely, it empowers the mind, and especially it is a very hard journey. When they have a supportive family, they feel very guilty, like because of them the people are suffering. And if they don't have a supportive family, then it is a very hard journey throughout their cancer. So why this cancer appears? Usually we know it is a genetic disorder. And in genetic disorder, the normal cells becomes cancerous, which multiply and spread rapidly. And one more thing I would like to add is, like I told you, the cancer, the complete thing, what happens is here, now, cancer, not only the physically, it is a cell growth, but also emotionally, it completely breaks down where even the social life will be affected. So overall, we can tell that the health definition, what are the four well-beings are there, all these will be hampered. So that is because of this genetic disorder where the normal cells becomes cancerous. And this happens due to error in cell division. We know genes send the instruction to the cells, whether to start growing or they have to stop growing. Normal cells usually listens to these instructions, but cancerous cells, they just ignore because they already turn to cancer cells and they grow rapidly. Why this error happens? That is again because there is a damage to DNA by harmful substances. Because we are more into diet part, so we are keen in observing which are the ones which is affecting, especially through the food. The first thing we can tell is usage of plastics. Our life has become so much of plastics. Like just if we turn around, we can find more than 10 plastic products. Example, just I bought a lunch bag in a jute bag, but the jute bag internal has a plastic covering because it should be a leak proof, because it has to sell well. And these plastics has n number of chemicals which actually disturbs the end. Those are the endocrine disruptors, or it even imbalances the hormones, even reproductive issues. That is the reason why so many infertility cases are going on, and also they cause cancer. And we know the box, what we use, it can be a Tupperware box or a melamine or a covers, whatever we use, everything has a plastic, might be a lower grade or a higher grade. What happens is, as much as we pay lesser for the plastic, so much we are more prone to the cancerous cells. Even if we go for the hotels, we all know that they pack it in a plastic boxes. Okay, we can carry our own steel box and we can get it parceled. But what if we eat there only? They give a melamine plates. Melamine plates is also a type of a plastic. It might be a higher end of plastic, but it is also a plastic. Even the Tupperwares, they tell it is a sealed and no germs or any grains will not get spoiled, and it will be in a Tupperware. Those are also the plastics. Even those are also not good ones. Those are also, it causes harmness. And also the coatings, especially whenever we do this nutrition course, we always first thing we ask them, what are the vessels you have at your home? In what all do you cook? In that first thing, everybody will have at home is a non-stick well. Dosas will be oil-free, and it is healthy being an oil-free, and it is very easy to put any dosas or chapatis or other things. These Teflon coatings on the non-sticks, or it can be a coating on the paper glass. When we drink in the paper glass, because those are also coated because it should be a leak-proof. These polyethylene coatings, or even the edible coatings like any food which has a coating outer waste. The government considers it equal because there is a certain amount it can go to our body. It is not harmful. Like it can be polyalcohol, silicates, or even so many other things are there. It usually what it does is that gaseous exchange will not take place, so that food will not get spoiled. Okay, there is a limit for us to take internally. But what if we are taking more than one product per day? Like we are taking some apples in the morning which has a coating, or some sweets in the afternoon which has a coating, or at the end of the day we are using some plastic glass or a Teflon coated products and things. Those are also having coatings. Even though those are edible coatings, the limit, the amount exceeds at the end of the day per person, like how much ever they have to take, it exceeds, because the products manufacturers will just see for their product. They don't see for the entire day what we are consuming. And once it exceeds, it is also harmful product which can alter our DNA or which can damage our DNA. And of course, these smoke, pollutions, all those also are very much effective. And these preservatives, many varieties of antimicrobial agents or antioxidants or nitrates, sulfides, so many preservatives are there in the market. Like each and everything has a preservative. Example, the bread. If you remember, when we were childhood, if my parents get bread, it was rarely brought to the house because bakery products was not as easily available like now, or it was not easily acceptable at home as it is now. So when we used to get a bread, maximum 1 day or 2 day. The third day, it used to get molds or fungus on that, and we used to just put it for the out street dogs or anything. We used to never eat that. But have you observed that now, even if we keep the bread for a week or 2 weeks, nothing happens. And the breads are also, variety of breads are available, and it is so costly. Each breads are so costly, and the higher the amount we pay for the bread, so much it has a it stays for a longer time, longer months. Also, we can tell. I mean, so much of preservatives are added in our food items, and these not only what happens is we can see the menarche in the younger age, and even the frozen foods. What the frozen foods are there, it won't get spoiled until it is in the frozen way. It will never get spoiled, but the note will be written on that. If you are using, or if you are opening this product, do not refreeze or do not keep for a long time. You need to use it. Use it immediately. So what the people think, okay, it has to be used immediately or else it will get spoiled. Actually, what does it mean? If it is not there in the frozen for a longer time, it will get spoiled. That means it's already a spoiled food. It will not stay more than 1 hour also outside. So such spoiled foods or preservative added foods have become too much, too much abundant in our lifestyle. My personal experience, there is a Adukale brand. I think you all know because they're advertising more. I'm just telling the one brand. There are so many such things. Though they advertise with the traditional chakuli or mikpat or so many varieties which are traditional. So in our house also occasionally they used to get it. I have an habit. Whenever there is something, I just don't eat just like that. I put it in a cup or a plate and then only I eat. I don't eat directly. So similarly, when the nippat packet was opened, when I just put it in a plate, I could see a fried cockroach in that. And we all know, once we see that, we cannot eat that anymore. And of course, that brand also I cannot eat anymore also. So I just wrote, I took a photo, I wrote to them. So I wrote to them, this is what it is happening. What they replied me is, please come exchange. We will give another product instead of this. You can come and exchange or take your money back. I went to the store, I gave back. I told I don't want any money back or anything exchange. On the way, I just met a person. He told, where are you going? I just explained what happened. He told, you can give a case, consumer case, because so many people, they do like this and they get lots of money from the company. But I had done the course also for the food product development. In that, it is mentioned clearly that 10% of any such things, unwanted things, or any such like this, the dust or any unwanted like cockroach or anything, is allowed. During the product development, it is allowed. 10% is allowed. I knew that. And if I go for a case, it will not stand. So when they can allow 10% of such things, you just think what we are consuming. I just wrote them a letter because if they are really genuine, they will just take care of the further products very well, so that it won't happen again. But we cannot expect anything more from that. And also one more thing, we had a nutritional class in Ramaya College. It was a theory and a practical session. Once we completed our theory, myself and Dr. Rekha, we gave them a practical thing to do about vegetable biryani. Okay, why we chose that vegetable biryani is, usually in biryani, they use curd. Keeping curd is incompatible. That should not be done. Many of them use even milk because they add kesar in the milk for the color and they add milk. We all know, anywhere the cereal or pulses are there or salt is there, milk, cow milk or a buffalo milk should not be added. That is also incompatible. So we told them, these two you can replace with coconut milk. You will get a same taste or better, healthier taste without incompatibility. because we have tried this so many times, and we gave them. We saw the ingredients, everything. Coconut also was there, everything was there. So we gave, and we just came out for the other discussion program. And once the dish was ready, we just went back and we tasted. It was good, everything. Then we saw near the sink that coconut milk pack was there. We asked, did you use fresh coconut? They told no, we had a coconut milk ready, so we just used that. Why did they do that? Because it is easy. They need not cut the coconut. They need not remove the milk. It is such a process, right? Minimum 15 to 20 minutes process. To avoid that process or to avoid that time, what they did is they just took the coconut milk ready thing and they added. See, even the coconut milk at home, when we are doing it, will not stay for one day. Then how much amount of preservative would have been there? And now we are more into that. Like it might be coconut milk or a puliyogre pack or a wangibath pack or dhania powder or even garlic ginger paste. So many things we are into it, which all has a preservative. And these preservatives also harmful in a larger dose, because we are in a complete daily, we are using that larger dose, and it is very much harmful and it damages the DNA. And not only that, the chemicals which are used to preserve our daily foods, it can be the flowers, they use the colors, or it can be cabbage or a broccoli or a gobi, where they use lot of chemicals. We had one brain tumor patient. She was from Belur. And root cause of her problem was they were growing cabbage and cauliflower in their land. And she tells, she accepted in front of us only that in a big generator thing, they just spread the chemical in such a way that while spreading, even she was inhaling it. The almost around 35 years, they were into the same thing. And because of that, she also told, I knew very well the thing what I have given the chemical for the others to eat, the same thing has come back to me, she told. And she had developed the brain tumor. She came to Ayurveda because brain tumor, they had neglected to do the surgery. And till now, even she is like yearly once she will visit and she will take some panchakarma, and she is well now, but they have stopped growing cabbage or cauliflower. But so much amount of chemicals they add to our even the daily food products what we use also. And apart from that, one more reason is abnormal elimination process. Abnormal elimination process, like what the damaged DNA, whatever is there in our body, the damaged DNA, it has to go out through the body, go out of the body. As the age goes, the excretion process or elimination process goes down, which leads to staying back of this damaged DNA, which can cause cancer. It was a theory which was used before, but now, even at young age also, the elimination process are not clear. And the second reason of death in US is cancer, because of lack of elimination process. People just pass their bowel movements 2 or 3 days once. They don't know their importance. If you remember, we always tell, or our next elder generation, they always tell, like my parents used to give castor oil monthly once. We used to clear our stomach. Even for myself, my mother used to give Triphala monthly once, compulsory she used to give, and to clear the bowel movements. But now we speak, are we doing it? Or are we educating people to do that monthly once? At least they have to get the stomach cleared. That we are not doing it. That is the one of the reason for this elimination process. Because one of the reason for the abnormal elimination process. We have to teach, and also being the doctors ourselves and our next generation, our kids also, we have to make them practice of one day clearing the bowel movements. Either it can be with the castor oil or a Triphala tablet, or even Bedi Soppu they call. That is also very easily 2 to 3 times we pass the motions and it gets clear. That has to be done. And lack of knowledge makes them this abnormal elimination process. We all know when the patient comes in the clinic, first question, like we will ask whether the bowel movements are clear. They have their own answers. Yes, it is clear. Then if we go deeper, how many times, when, whether it is morning or evening, or with the help of a coffee or a tea or a walk, or without that, then the answers keep coming out. It might be 2 or 3 times a day, or it might be in the evening or night, or it might be 2 times in the morning, or 2 to 3 times in a week. And you know how people easily they tell, no, I pass like 2 days once, but my bowels, I make sure my bowels are very clear in a week. We really don't understand how colonoscopic eyes they have, where they feel that their intestines are completely clear, going for weekly 2 or 3 days. That is clearing the bowels. That should not happen. We have to educate. Education is, giving the education is also our responsibility. We have to educate them that it has to pass in the morning without any help, so that elimination process will be, at least these bowel movements will be in the control. And another thing is lack of whole diet. Whole diet, it may not, I'm not speaking in the terms of carbohydrate, protein, or fats, but whole diet in the means of shadrasa. When we don't have a shadrasa, the whole complete diet, that will not improve our peristaltic movement. Mainly, we miss amla rasa in our diet. Majoritarily, we miss amla rasa and at the end, kashaya rasa. These two rasas we usually miss, which where there is, because of which there is a lack of peristaltic movement, which is a reason for abnormal bowel movements. And also incompatible foods. We all know incompatible foods has become a part of life for the people. They just use, because incompatible foods are always palatable. It is so tasty, so yummy that people can't resist eating, but they don't know the knowledge of incompatibility because it is not seen immediately. Even when we studied the same, right? Incompatible foods are poison. Poison means what we feel generally, oh, we will die immediately, but nothing happened to us. No, incompatible foods leads to autoimmune disorders, or the hormonal changes or a DNA changes disorders like cancer or any other diseases that we need to educate. And excess or lack of physical activity. This also lowers the metabolism. Because of lack of physical activity, lowering the metabolism also will cause this. And lack of proper sleep. What happens now? It is a thing that 7 hours sleep or 6 hours sleep has to happen. So even though they sleep at 12 o'clock, if they are waking it up at 7 o'clock, it is fine. They had a 6 to 7 or 8 hours of sleep, what they feel. But actually not. Our sleep should be from night 10 to 2. That is Pitta Kala. Sleeping in the night, Pitta Kala will always help in correcting our systems. So lack of sleep is also one of the reasons for the abnormal elimination. And we all know cancer causing genes, there are 3 types. There are 3 types. That is, one is proto-oncogenous, tumor suppressor genes, and DNA repair genes. What does these do? These proto-oncogenes, they are involved in normal cell growth and division. When these genes are altered, we know they are more active than normal, which can cause cancerous cells. If we observe the higher in Vata, when the Vata is on high side, the cell growths are impaired, and when Pitta is on higher side, the cells grows faster. So the food or lifestyle also, which increases Vata and Pitta, like example, we can see gray hair at the young age, even at the young age of 3 years. Gray hair coming at 3 years is not a normal. It is a pitta, high pitta in the body, which is exceeding. The body age is exceeding. Even the cells also might exceed further. And even we can see early puberty at the age of 7, 8 years. Menopause, early menopause. We are seeing the cases, we all know 40 plus, we are seeing the premenopause and menopause. But recently we got a case of 33 years menopause. All her reports were showing it. She is under menopause, which will cause that. So controlling this Vata and Pitta in the diet will help in these genes, proto-oncogenes to be in the normal. And tumor suppressor genes. We all know the genes which helps in suppressing the tumor. If that is impaired, then the tumor grows very faster, again, which leads to cancer. This can be related with higher in kapha. When the kapha is on higher side, that is lower metabolism, can cause this, can slow down the or delay this tumor suppressing, which causes to cancer. Kapha regulating, one thing is food. There are so many foods, especially the junk foods, which increases kapha, especially the bakery products or refined flour products. Apart from that, lack of physical activity. lack of physical activity, like especially in India, we don't give much importance to physical activity. We don't teach the next generation also about the physical activity. What the people generally think is physical activity is only for the obese or overweight or a diabetic patients, not for the normal weight or anything. No, physical activity is just to increase the metabolism, and that we have to go through. And when it comes to the refined flour products, we can see even the house cleaning persons, children are also having bread bun biscuit in their hands. Before, how it was, either the any bakery products or a bread or a cookies, all those would be on higher family foods, not the lower family foods. But now it has become ulta. They are into more cautious about the diet, and they are having the salads or soups, and this has come to the completely middle and lower level, where the diseases are keep on increasing. Next is a DNA repair genes. DNA repair genes, if it is good, it fixes and fixes the damaged DNA. And this can happen only when we sleep in the night properly. That is, when we correct our circadian cycle. Especially circadian cycle of Pitta Kala in the night, 10 to 2 is a DNA repairing or a hormone repairing time. If we do not sleep during that time, if we are awake during that time, then it definitely leads to suppressing these DNA repair genes, which leads to cancer. And when it comes to metastasis, we know when the cancer spreads from one part to other part, we call it as metastasis. To diagnose cancer, there are so many blood tests. It can be CBC, CA125, or tumor markers, or it can be CT, PET, or MRI, or biopsy. Test, we know that once they enter the allopathic hospital, test goes on for a month, and end of the thing, majority of the reports will be with a question mark, and each time they consult different doctors at their system, they will have a different opinions. We from Mahanasa, we can say our uniqueness of approach starts from here. Like, if they have not got the biopsy done, first thing we tell is not to get the biopsy done. Because when the biopsy is done, when the needle is injected, that also causes increasing of the cellular growth, which gives the way for the metastasis. When the biopsy is not done, it is really easy for the treatment. But when the biopsy is done, it is a bit difficult, and already metastasis has happened after biopsy for a longer time, it becomes more difficult. We had one patient. He was very well known person's father. We know her very well, and her father it was. At night, 9 o'clock, we just got a call. They told he had a severe stomach pain since 2 days, and morning they admitted, and they went through all the tests, and they went through the MRI also, which shows a like pseudo kidney type of a growth in the epigastric region. So they're asking to go for a biopsy. What can be done? We just asked, what will you do? What will you do? They told, if you tell yes, we will go with the biopsy, or whatever you tell, we will do. Okay, I just asked, okay, after biopsy, what will you do? And they told, whatever it is, we'll come to you, we'll take your treatment. Are you sure you'll come to us and take the treatment? Yeah, we are very much sure. He is also sure about that. The patient is aware of that. Yeah, he also wants, he was already telling from the afternoon, just take me out here and take me to them. Let us start the treatment. Then we just told, if you're really coming to us, continuing with us, we don't require biopsy report. You just come out of the hospital and meet us. It took more than 1 day for them to come out of the hospital, because they just went opposing that they don't want a biopsy. So we started the treatment. After 3 months, we told to enter the same hospital and get the scanning done there only. And when it was done, it was completely cleared. There was no mass, nothing. And they didn't speak anything. They just sent. Might be, even if they would have spoke, they told it may not be a cancer. It might be a benign tumor or just a cellular growth. They would have told that. But whatever it is, our main responsibility is to treat them, not to create the case studies. So we didn't want to create a case study for our sake. We didn't want to get them the biopsy, then after the metastasis. We didn't want that. We just wanted them to get clear. So that is our first approach. We usually don't, if we come to know, we don't tell them to take the biopsy. But if already they have taken the biopsy, and then if they come to us, still we treat them, because without knowledge they have already done, then we cannot change it. So we still take them and we continue with the treatment. If it is a stage 1 and stage 2, of course we all know it is easy. Stage 3 can be managed. Stage 4 is really difficult to treat. I still remember my first case, 9 years back, first case of CA, where it was a stomach cancer. I mean, it was completely bulged, and she was around 21 years. She had a 1-year-old kid, and her mother used to take her and come. And after 2 months, I mean, she was taking with the help of her guru, we used to give her the treatment. After 2 months, she just expired. And because of that first case, I mean, I was feeling so guilty that I didn't give a proper treatment. That was the reason she expired. But my guru, he just told, no, we all have done our best. And I mean, she had a good death. Don't worry about that. It is all happened. So we have done our best, he told. After 3 days, actually, her mother called. I was really scared to receive the call, because it was initial stages when we started our cancer treatment. But when I received the call, she was crying so badly, but still throughout the cry, she just told, I just called to thank you, because you did so many things, so that her hospital has completely neglected, and they told might be 1 week she might leave, but 2 months she extended. And we can't help whatever her death was there, but you all gave a good treatment. To thank only she had called, even with that pain. So we can just tell that we can give a good ending, or a good death also we can tell with the 4th stage with our treatment. When it comes to the treatment types, there are people, as I told you, who come only Ayurveda. They believe in Ayurveda. They don't want any other thing, only Ayurvedic treatments. And this will really help, because believing in Ayurveda, believing in Lord Dhanvantari will definitely not leave us. It will show a good path. In fact, 10 years back, when me and Dr. Rekha started this clinic, and especially when we were thinking about the cancer, I mean, as a doctor, we just keep talking something. So we used to, what happened, I mean, what to do if we get a cancer? So we had a dilemma, whether allopathy or Ayurveda. But now we are very much sure, whatever happens to us, it should be only Ayurveda. And not only in the cancer, so much we have trained even our kids and people at home, that without our knowledge, if we faint, or if we don't have a conscious also, they have to take to the Ayurveda treatment only, if not to any other hospital. Like, even we have trained, because now we purely believe in Ayurveda. And especially after COVID, because during the COVID, we completely dependent on the Ayurveda treatment, and it worked such a wonder. We very much that Ayurveda will never leave our hands, or the patients who comes only for Ayurveda treatment. And a few people will come Ayurveda after surgery. They may not be knowing before surgery, or even though they know, they will be forcibly with their family members for the surgery for further, so that it should not further grow or anything. For that sake, they go with the Ayurveda. We have a breast cancer person. She just inquired about Ayurveda through Google, and she read somewhere Basti has to be done, and she called us randomly. She called us. When she called, we told, no, that is not the way. Her CA 125 was very high. That is after surgery, after removal of one breast. We told, that is not the way. You just come and meet us. We will explain. You just don't go according to the Google. We'll tell you what to be done. So once she came, we explained the treatment part, diet part, everything. And she underwent everything. And after 6 months, when she checked, it was I think it was 1.5 something. I mean, she was also so much shocked that it randomly reduced so much after the treatment. And even now she's following her diet, whatever we tell. If slight pain or anything occurs, also she calls us. I mean, whatever she has eaten, she will give us a list. We will correct in that. We will tell what to be done. Because after a stage, we cannot continue with the medicines for a longer time. It's only the diet which will help for a longer time. Still, yes, she will come, she will undergo Panchakarma. Even though we tell, don't want, it's not required for you, you are better or good, she don't listen, she will undergo. We will give a mild dose for her emotional sake, and we will send her. But she is good, she is doing good with the diet. And another set of people where they come only to increase immunity, after the allopathic treatment, I mean, along with the allopathic treatment to increase the immunity because they're already into chemo, radio, and also to avoid side effects of those. Actually, what happens is this will actually never work. I mean, they are giving the chemo or radio there or their part of a treatment, and then we are going along with to increase the immunity. It doesn't work. Even we know, just to say of running the clinic, we take such cases, but we have seen where from Hubballi, one person, others were also there. I just remember her. I'm telling you, she used to come, she used to take chemo, and then she used to come here, take medicines and go. So many times we used to tell her, no, you don't go for that, go for these treatments. She didn't listen to us, but she went on going week, day by day by day. And after 6 months of her follow-up, she didn't come back. We don't have any of her relative contacts. We don't know what happened to her, but it doesn't work. It doesn't work in that way. Recently in a speech, we just heard a well-known, a reputed brand. They were just telling about the research paper that during the COVID, they did for COVID, second grade of the COVID thing, where it was on higher side, they gave Ayurveda medicines along with allopathy, and it worked wonder. Those research papers are available. Please go through, they just told. Yes, Ayurveda medicines works wonder. We understand. But will they agree? Will the allopathy, what we have done with hands-on thing, will they agree? They tell, no, our medicines worked. It was just yours was just immunity developing or some other. They just name it. It was such a well-known brand. They had a good hospital. They could have done only Ayurveda. Actually, it would have done work wonders. But don't know why they mixed up and did. We speak that going with allopathy, hands together, will always help all those. But at Mahanasa, me and Dr. Rekha, we both believe that rather than going together, it's always better to go only with Ayurveda. Only Ayurveda can work wonders. We are superior. Ayurveda is superior, not we. Ayurveda is superior, and following Ayurveda will help. Whatever it is, it will help. We need not join hands with any other allopathic treatments. It's not required. That is what we feel. Let us join with yoga or naturopathy also. We don't tell completely, because the food part comes completely opposite with naturopathy and Ayurveda. What we tell, what the naturopathy will tell, will completely opposite. So few of the naturopathy treatments and yoga along with Ayurveda will definitely help to overcome. And treatment approach next is, we know that each person's cancer has a unique combination. There is a unique combination of genetic changes. And as the cancer cell grows, it might change. Again, that genetic combination can change. It is not the same as it is in the starting. In the middle, it can change. At the end also, it can change. When we know this, then why the treatment part of them is the same? They go with the surgery to remove the cancerous tumors, or they go with the chemotherapy to destroy the cancerous cells, or radiation therapy, or immunotherapy, or it can be targeted therapy of the genetic mutations. It can be hormone therapy, that is blocking the cancer-causing hormones. Even it can be bone marrow transplantation, that is replacing the damaged stem cells. The same thing, without going that, we have Panchakarma. The treatment approach of Panchakarma, according to the place where they have a cancer, according to their Prakriti, we can decide which Panchakarma, and it is equivalent to surgery. We have seen so many cases, it is equivalent to surgery. Then diet, rather than going for chemo or radio, the cells, what does chemo or radio do? It destroys the cells. The diet can avoid growing of the cells and also remove of the extra cells. That also it can help. And our medicines, Ayurvedic medicines and immunotherapy is well linked with the Rasaushadhas and lifestyle changes and correcting the circadian cycle and giving them the rasayanas would be more easier and more healthier than going for any other sort of treatments. So when the patient comes directly without biopsy, we treat in these approach. When they come after biopsy or after surgery also, we go with the same. But what happens many a times, I told, cancer is just not a physical growth, but even the complete emotional damage and things. More than that, not only cancer take over the health, but even the family people also take over the person. We had one person from Hosur. She had a breast cancer. One breast was removed, and another one, it has already started. They didn't want to go for allopathy further, any chemo, radio, or surgery. They came to us. We were giving the treatment. After 6 months, it has not increased, but not reduced also. It was the same, but her life quality was improved. That we could say. But her so-called educated children, one was in US and another, her daughter was in Chennai. They both came and spoke to me. It has not seen any improvement. We told, see, it might be, it is not reduced, but still it is not increased. It's only 6 months of treatment. Let's wait, let's continue. She doesn't have any problem. Her tiredness, everything is, her symptoms are getting better. So why do you want to interrupt now? They didn't listen. They just took her and they got the surgery done with the chemo. But we came to know that after 2 months, she was no more. Many a times it happens, even though they are willing or wishing to go for Ayurveda, the people surrounding them will not be will not be able to understand about the Ayurveda. So apart from all this, these approaches, one more comes a major thing is cancer diet. Not only for the cancer patients, but also it helps in avoiding the cancer, because when the family tree or a family, so many persons are having a cancer, then these diet will help them not to get the cancerous cells also. So, but this cancer diet, what it is there, that, as I told, we will be speaking in the next session. So today we'll go with the case presentation. Case presentation will be done by Dr. Rekha. And after the case presentation, in the next session, we will go with the diet approach for the cancer from Mahanasa. How do we do it? So I'll just hand over to Dr. Rekha.
Thank you, Dr. Archana. Welcome, Dr. Rekha. You can start your session. Sorry, you are not audible, madam. You are muted.
Okay, good afternoon, everyone. Dr. Archana was talking about how do we handle the cancer patients. The journey wasn't so easy, and it's not, like sudden changes that suddenly that, as soon as we opened the clinic and we started to do the cancer thing, not like that. So initially, when we done, our education in 2008, so both, me and Archana wanted to practice pure Ayurveda. Okay, only Ayurveda. So we decided that, we don't practice any other thing, mixed thing. We only practice the Ayurveda. So during that time, most of the persons, having diabetes and BP and thyroid, those people were coming. And we were thinking that, how to cure them, right? So because in the college and all, we didn't have that much of experience that, we can cure. And we had in mind that, if the person suffer from the diabetes or the thyroid and they have to go with the allopathy medicine, it's a lifetime medication that we cannot cure it. But during practice, when we trusted on Ayurveda, so we got the result within 2 months, within 1 month also we got the result, and person got cured completely. So later stages that we started to get the patients, different cases like, trigeminal neuralgia or pancreatitis, ulcerative colitis, even cardiac, blocks, cardiac calcification, those patients and all we handled very well, and we got the result within 1 month, 2 months, even within 3 months is completely cured. All reports are usually whoever comes to our clinic, we don't write any diagnostic prescription like, some particular diagnostic center. We will tell them wherever you want, you take the report and you come to us. So they usually take before and after the treatment reports, and they will come to us and they will show, and many people has written the review also. So those trusted patients started to refer cancer patients to us. So initially, like Dr. Archana told that, we had a confidence, more than that chemotherapy or radiotherapy, our medicines definitely works magic. That's how we started to practice cancer treatment also. So here I'm going to present a case that, like I think in 2003, the patient came. So I will just share my presentation here. Can you see the screen?
Yes, it is in.
Yes,
You can-
doctor.
Yeah, okay. So today I am presenting a case about cancer of hypopharynx with esophageal candidiasis and antral gastritis. See, hypopharyngeal cancer means the extra cell growth, it's abnormal cell growth of the cancer cells in the hypopharyngeal area. It's just behind the pharynx, lower part of the pharynx. Along with that, this person has a esophageal candidiasis. Let's say fungal infection in the esophageal region and antral gastritis. It's a gastric inflammation in the antral part, that's the lower stomach part. So usually these hypopharyngeal cancer will be squamous epithelial cell cancers. The most of the person will be suffering from the difficulty in the swallowing of water or any food articles. There will be a discomfort in the ear, and voice changes will be there, and difficulty in the breathing and painful in the throat also. The most of the these cases diagnosed with the biopsy or PET scan, even endoscopy also. And the common line of treatment will be surgery. Whatever the tumor is there, they will remove it. On top of that, chemotherapy and radiation will be there. We got a patient from Andhra Pradesh, that is Anantapura. Her name is Krishnamma. She is about 70-year-old and housewife. And interesting part is the son who brought her here to our clinic. He is a allopathy doctor. He has a hospital facility in Anantapura. Okay. When she initially came to our clinic, she had the chief complaint of difficulty to swallow food, especially even for the water, severe gastritis since 6 months. When I talked about her condition with her son, he told that initially she felt something is stuck in her throat. And she was feeling that, not comfortable to swallow the food. After she thought that, even he thought that it's just a severe gastritis that she was suffering from since earlier. And even she had a burning in the chest also. He was keep on giving that Rantac. She was addicted to Rantac tablet also. Then later, it's a progressive stage. It became like, it was difficult to swallow even water. So I asked about the history, and like she said that, after every meal, she used to get a burping, so much burping. And it is aggravated gradually, even some extent change in her voice also, everybody noticed. This changes has noticed since 6 months. The character was, it was so difficult for her because she was not able to swallow food and liquid. Along with that, she had a severe knee pain also. Because of that, she was not going for a walking or she was not doing any exercises also. And I asked about the aggravating or relieving factor. She said that nothing, because she cannot even swallow water properly. So she was like, she said that no, she started to cry. And the previous treatment, like she didn't go for admitted to the hospital or no major treatment has done. She was only addicted to Pandy tablet. When I asked about the past medical history, she had a knee pain since 2 years. Other than that, she didn't had any medical history. But interestingly, when I asked about the family history, she told that, her mother and mother's sister, both the sister had died with the cancer only. The elder sister, her mother's elder sister had a breast cancer, died in 2024. Sorry, this is her own sister, elder sister, died with a breast cancer. And the mother had also breast cancer and she died in 2002. And mother's elder sister is suffering from the urinary bladder carcinoma. So she is taking treatment currently with us. And mother's younger sister is suffered from the cervical cancer. She's died in the 2016. And the cousin, the patient cousin had a uterus cancer. Uterus got removed in 2018, but later diagnosed, recently in 2024, she diagnosed with a lung cancer and the 4th stage and recently passed away in December. So that's why the patient and patient family were so much worried, because the mother side, everybody had a cancer and they were so scared. Even son has done, practicing, and he has his medical setup, everything. He was also sitting and crying for her mother in front of me. When I checked about the vital signs, the blood pressure was normal and the heart rate was normal, respiratory, everything was normal. Nothing was elevated. In systemic examination, when I was doing inspection from the outside, that is, everything was normal. She was looking completely healthy. She was normal. No visible swelling or no asymmetric neck was found, and palpitation, everything was, there was no tumor we found external examination. But when I saw her endoscopy, it has been clearly mentioned that there is a friable ulcerative growth noted in the hypopharynx and white mucosal plaques noted in the mid-esophagus. Erosion seen in the atrium part, and it has been mentioned as a CA hypopharynx with esophageal candidiasis and antral gastritis. Then they came to Bangalore and to the Sankara Cancer Hospital. There they have done the biopsy. It has been mentioned that hyperplastic squamous epithelium with the papillomatosis, ulceration, and focal low-grade dysplasia. No evidence of invasive malignancy. Post-cricoid growth biopsy suggests clinical correlation or repeat biopsy from more representative sites. Okay. This was a Shankara Cancer Hospital biopsy report she has done on April 2023. And after seeing that, the doctor suggested that it is 99% is the cancerous, and there is so much big growth is there. They wanted to remove that, they wanted to remove the section of esophagus and the respiratory, pipe also. So it will be very difficult for her after that, it's to maintain, because he is the only son they had at home, and father was already, he had a epilepsy, and it was very difficult for him to take care of them also. He was so confused what to do, and they were so, scared also. So doctor suggested he took the 2 months of timeline, so that because they have to move from the Anantapura to Bangalore to do that surgery, even radiotherapy, everything. So that's why they taken the 2 months timeline. So decide that what to do. Okay. So, but they didn't waste the time. In the Sankara Hospital only, we don't know who is that. I think earlier that we had treated that patient, and they met them and they referred, why don't you go and try Ayurveda, Mahanasa Ayurveda? You can get the treatment. So on that day only, in April only 2023, same day, 5th, they came to the clinic and met us. So differential diagnosis that we can do different thing, but these are all the different diagnoses. But they came with a clear picture of, biopsy and endoscopy. Even that son has done all his research that what he can do, and he came with the CA of hypopharynx. So like I said already, the treatment plan for in Shankara Hospital was, they suggested removing the foot pipe and some part of the airway, which was the major surgery that they don't wanted to go for it. At Mahanasa, the first thing that we do, Nidana Parivarjana. So for whatever the thing is, in Ayurveda, whoever comes to our clinic with any disease, that we will make sure that what do they eat. We will take complete history of their diet chart and the lifestyle chart. So I asked them, so what is her food habit? How is it? So they told that she usually consume, lot of chutney pudi and the pickle. She is a spicy person. She wants spicy food. Even though she was suffering from the gastric issue, she was ready to take pandy on everyday basis also. She cannot live without this chutney pudi and the pickle consumption. So you might Google and see that most of this hypopharyngeal carcinoma comes for the smoking and alcoholic consumption patients, mainly. Okay. She is a non-smoking person. Only thing that triggering, in Ayurveda, we can say that, Dr. Archana was talking about Viruddha Ahara. Like, she is a Pitta and Vata predominant person, Prakriti. And she was consuming this chutney pudi and pickle because she used to tell that, since childhood we are Andhra, no, we eat so much spicy. Even in front of me, like she said the same thing. We are Andhra people, no, we eat so much spicy. And she's a non-vegetarian also. Weekly thrice or 4 times non-veg was compulsory. She used to eat, even though there is no major proteins like chicken. She used to consume a lot of egg also. Like every day, some or the other thing non-veg taste should be there. Even she was not eating any outside junk food, but most probably she was preferring mainly that fried item like bhaji, bhujia. In the evening time, she needed some snack like the chekuli or kodbale, something, fried item she used to have with the tea. And the tea also, like twice or thrice a day, she used to consume a tea. And being a housewife, she has this habit of day sleeping also. And because of knee pain, she was always saying that she cannot walk, she cannot do some physical exercises. I could say that she is quite a lazy person to do the physical exercise. And son was complaining, madam, I am telling since long time that, to cure this, like knee pain and all, you have to do exercise, you have to go for the walking, but she doesn't listen. So she is just, even somebody is there to cook also, household help is also there. So she was doing very minimum exercises. In Ayurveda, when I was doing the physical examination, I did notice that she had a weight loss also, 3 kg of weight loss also. No obvious external swelling was there, but there is some discomfort she was feeling while speaking. So in Ayurveda, so whatever the modern text says, but in Ayurveda, it's very simple that, whatever the condition is, the first thing that we have to see how is her Agni, right? Agni Dushti that we have to clear. And because of Agni Dushti, there will be Ama accumulation. That also we have to clear. And dosha predominant, that is Kapha and Pitta, I would say, because of Kapha accumulation, there was a obstruction in the throat. And Pitta was aggravated since long time, and she is taking some symptomatic relief. So first thing that we try to clear the Nidana Parivarjana. So we cut up all her favorite, like chutney pudi, pickle, non-veg, fried item, everything. We had made curative diet chart for her, especially for, otherwise they don't follow actually. We told her son, because he's a doctor, he will understand that. We told that you have to send every day meal picture for us, because we should know that she should, she should little bit scared, because she shouldn't ignore her diet, because diet is the last part that patient listen. Medicines that they usually take, any treatment that they usually take, but the diet part usually every patient that ignores. That's why we made her strictly saying that you have to send the picture of lunch and dinner every day, and the no more snacks. If you're eating snack, only fruits or healthy something, whatever the chart that we had given, that she has to eat and she has to send the picture. They agreed for that. And after that, I told that Nidana Parivarjana that we have done for her. And then the Shodhana therapy, like Virechana, even I have suggested some, all the Panchakarma for her, but they were coming from Anantapura. It was difficult for them. They had stayed here for 15-20 days, and even father was bedridden. So that's why that they had to go back, and they have done the Virechana first. And for the knee pain, that we have done the Janubasti and Matrabasti. Along with that, some Shamana Chikitsa, like some medications that we had prescribed for 1 month. Initially, for the 1 month, we had prescribed Panchatikta Guggulu Gruta, Kanchanara Guggulu, some Swarna Bhatma preparation that we had prepared in our clinic, that we had given. Even like, to control her gastritis issue, that Estimadu Shirapaka, Narikela Lavana, that everything that we suggested her. And we strictly told her no more symptomatic treatment like, Rantac or Pandy, that she shouldn't touch anymore. Even for the knee pain, she used to take many analgesic also, painkiller also. That also we told her strictly she is not taking any of medications other than Ayurvedic medications. Then in 1 month, she could see the changes. Within 1 month, she was able to drink water comfortably, and she was able to swallow the food comfortably, and she was so much happy. So after 40 days that I told that, yeah, it's like it's working and she's feeling comfortable. She can drink the water, everything. So take it medicine for another month and let's see. So in 2 months, within the 2 months, uh, she is feeling comfortably, no discomfort, nothing, no gastric issue. So she felt very good. Usually, like I told that if you want, you can take again endoscopy and PET scan also. If you want, you can take and confirm it. Then we can continue the treatment if required. So after 2 months of medication, they had taken the pharyngoscopy. And surprisingly, in Shankara Cancer Hospital, they didn't find any tumor. The doctor was so surprised because the patient's son is also allopathy doctor. He had so many contact in that hospital. They were personally looking into Krishnamma. So they were so surprised there is no any mass they could able to find it. And they have done the PET scan again. The result came like mild thickening involving of the post-cricoid region and adjacent pharyngeal wall. There is little bit thickness in the skin. That's it. There is no tumor, there is no ulcer, there is no inflammation, nothing came. This was the PET scan report after the 2 months of the result. They came in the 2023 April, and the PET scan has taken in the June 2023. Just about the 2 months of the span of the time, the PET scan came clear. Okay. The son really, like Dr. Sujit Reddy, his name, that he really, like, I don't know, he couldn't able to believe that how does this Ayurveda work? How does, this magic has been worked? Because his family, he has seen so many deaths with the cancer, and he was so scared of his mother health also. And he couldn't, like, he didn't know how to thank Mahanasa team. So when he was sitting in our clinic, one patient came earlier that he had a lung consolidation. In a hospital, they have told that he had to undergo for the surgery. He came just 1 month before and he has taken the treatment. He's just, the daily wages guy. He cannot afford any medication money also, that we had given treatment for him free actually. So in 1 month, he came with the result with a clear chest X-ray. And that Sujit Reddy doctor was sitting in front of me and he saw that X-ray and he was feeling so wonder, Madam, how does this Ayurveda work? I never explored Ayurveda earlier. So I didn't know that, this kind of, in allopathy that, we could have cut his chest, part by part and day by day, and the patient might survive, like for the initial symptomatic treatment like that, we might do the surgery, but he will be, suffering till his lifespan. We might extend its lifespan. That's it. We cannot cure any pain. We cannot even cure any disease. But how can Ayurveda can work this magic? So finally, this is the testimony he has written in our Google review. You can even see Mahanasa Ayurveda Google review. He has written by himself that he's saying that. I will just read it for you guys. My mother had difficulty in swallowing. On endoscopy, there was a huge post-cricoid mass in food pipe as per cancer specialist. Biopsy done suggested mild dysplasia with the inconclusive diagnosis. Doctors in Shankara Cancer Hospital said it may be cancerogenous, even the age, location, gender, and size of the mass, and advised she might need a surgery removing the food pipe and some part of airway, which was the major surgery. I was afraid about the outcome, if so, the burden on day-to-day activities. Oncologist team had given us a 2 months window period of surgery. We were running out of time and options and scared to the core. One of our family friends suggested to consult Mahanasa Ayurvedic Center. Mahanasa doctors has assured us about the recovery tailored treatment regimen went on for 40 days. After 40 days of her symptoms improved remarkably and there was no difficulty in swallowing. Mahanasa doctor suggested few medications to swallow at home and nothing else was needed. To confirm the same, we went back to Shankara Cancer Hospital and consulted the oncologist. They have done repeat endoscopy, which revealed no mass and completely healthy food pipe. Even the Shankara Cancer team was surprised and ordered a PET scan. To their surprise, even the PET scan revealed to have no mass and was healthy inside. We thank Mahanasa Ayurveda for their expertise and the patience. And that's it. He's telling thanks to us. So, like this, not only this, so many cases. Did I close the window? Okay, sorry. Like this, so many cases thus we handled actually. Really different cases. Like earlier I was telling that trigeminal neuralgia, pancreatitis. Recently that one case has found out and they are coming to from USA, they are coming to the India for the treatment of pancreatic cancer. So how it start? Most of the people with usually the disease will start from the beginning, like first gastritis, then the ulcerative colitis, then they will take a lot of medication for that, then they will end up in the pancreatitis, then they will end up in the pancreatic cancer, like that. Even during COVID time, I just remember one case, cancer case. That lady, she was around 30 to 32-year-old lady. She had a thyroid cancer. And in the Manipal hospital, Udupi, she got admitted and they told that she needed 3 times of chemotherapy presently. Now, after that, we will see that. They were very poor. They didn't have money because one chemotherapy session cost them 50,000 rupees. They didn't have that much of money. But still they are trying to arrange it and they had given them like the same 2 months window time. So during that time, because of COVID, all hospitals are stopped treating cancer patient because they were busy in treating the COVID patient. She approached me, doctor, is there any cure for that? So from Mahanasa, usually that we gave that, anyhow, you have a 2 months of window time, just why don't you try that? We gave the diet chart, everything, and we have treated her. So after 2 months, once the COVID, lifted out, I think October, she reached us in the March first week, and October she went to the Manipal hospital for the chemotherapy only. She didn't, she didn't even thought that it might have cured. She was taking the treatment actually, even though we told that after 2 months it's enough. That she wanted to continue till October those medicines. In October, she went for the chemotherapy. She has taken same kind of, PET scan, everything. Then there was no tumor. So doctor was surprised, but she didn't reveal that, she has taken the Ayurveda to the doctor. And doctor was so surprised that, where was the tumor gone? They couldn't able to find the tumor in the thyroid. So she came out, she got the 50,000 and she told that, shall I give it to you? I said that, no, you already given the medicine price. That's enough for me. No need to give the 50,000 rupees. So like that, many cases has happened. Like Archana told that, before doing the biopsy, if they come, it will be very easy for us. But like our guru says, Ayurveda Nidana alla, Ayurveda Barore Nidana anta. Like present Krishnamma case also, the patient come with all the reports and all the diagnosis, all Google research, everything they will bring it and they will sit in front of us and they will tell that, please save us. And even if you tell that, okay, we will give the treatment, they will tell, can you please guarantee it? So nobody can guarantee anybody's life, but still we will try to convince them. Let's see. Anyhow, you have 2 months or 3 months of window, even though if you are taking the scan, everything, you meeting the doctor also, it takes 2 months time. Just take 2 months of medication. Let's see the progress. Then we will decide. But in 2 months of time, we had treated so many cancer patients and they came out with these magic, diagnosis also, magic result also they had came out. And we feel like, me and Archana, that we are practicing pure Ayurveda, and we feel very proud of ourselves actually, because it is healing. So most of the, all medicines are good, and all Ayurvedic medicines are good, but only thing that we see the difference, why we are getting 100% result, is because of we are correcting the diet. See, root cause. So whoever comes to our clinic, the first thing that we will try to find out the root cause, why they got it. So if the person is not able to ready to follow diet, lifestyle changes or diet, then no use of giving any medicines. So that's what we clearly convey them. If you want to correct your diet and lifestyle, you come for the Ayurveda. If you are not ready for the, you are because of job, or you because of your lifestyle or fancy lifestyle, then you go ahead with, whatever you want. If Ayurveda, if we want to treat you, then you have to correct your diet and lifestyle. And I think next session that we will tell that how do we correct. Simple only. We don't give so much complicated recipes or so much complicated ingredient. Even many people think that Ayurveda recipes are so only khichdi or only, that kashaya or something. It's very difficult to follow. We don't do that. If Mandya person want to eat ragi mudde, we will tell ragi mudde. If North India person North Karnataka patient want to eat jolad roti, we'll tell them eat jolad roti only. The few things that we will change it so that it will alter his, this disease condition. That's how we treat. Thank you so much. If anyone really have any doubts, you can raise your hand and we can discuss. Another, I think, 10 minutes time is there.
Thank you, doctors. It was very wonderful presentations. We have to leave early, right? So we'll take the questionnaires first, or else I'll take the vote of thanks first. Otherwise, everyone will leave early. So we'll better go for the vote of thanks first, and later I'll take the questionnaires. Vote of thanks, I'll request Dr. Shubhamangala Madam to give the vote of thanks.
Thank
Over
you.
to you, ma'am.
Thank you, Dr. Rekha, Dr. Archana. It's a wonderful session, and it's very encouraging for the doctors in this group. However, Dr. Shakuntala Madam is doing a lot of work. I should apologize. I'm not doing much nowadays. Too many involvements, too many things. So as you mentioned, the food itself is the cause for all the problems. So you are treating it with the food. That's a great thing what you are doing. Ayurvedic barake jana hedrukotar because patya, and they don't understand. Even many Vaidyas, they just restrict them with so many things. They just get scared. So maybe your approach is better than that. I can see in how the results are. Definitely, you are doing Yukti Vipashraya, Sattva all together. I usually add one part in this is Daiva Vipashraya, where mostly, all these cancer, these such chronic conditions are due to Purva Janma Krita Papa and other this thing. So usually this is the just what I'm doing, I'm telling you now. And also these medicines which they take for antacids and analgesics, I feel they create more problems, especially during cancer. It goes to next level. I feel it goes to next dhatu level. So just by stopping that and going back to the best food, and it's really good. What you're doing is a great job. So we are eagerly waiting for your next session with lot of suspense. So thank you very much once again, and thank you, Dr. Geeta Jaiswal and Dr. Kanchana and Dr. Geeta Puttur. After a long time, I'm seeing all of you. Thank you very much. Yeah, I think you should go back to the questions sessions now.
Sorry. Someone has raised the hand. They can unmute and ask the question directly.
Doctor, have you unmuted? Sir, if others have any questions related to the presentation, kindly unmute yourself. And I asked Dr. Rekha and Archana whether we have time after 4:30 also. if we can continue for further 10 or 15 minutes, if the questions are continuing. Is it okay?
We had given the appointments actually.
No, no,
Next
okay.
session, we will keep ourselves free for the questions.
Okay, no issues. Just, yeah, please.
I
Please
think even
continue.
they will have questionnaires after the patyas, that is diet chat. I think they will have more
Yes,
questions.
they will have more
Because
questions. That's true.
Yeah, we all are doing the cancer treatments. During that time, we might get the more questions.
Yes. If
Question
anything is there, we'll convey to you now. So
Sure,
that
sure.
Yeah,
you
I
can
think-
answer in the group also.
Yeah, we
Sure.
can add it to our next slides also, the same thing, and we can answer that.
Sure. Okay.
So next session, that's what March 26th, Wednesday. Again, it will be on the same time. As it comes in the Patya Sati Gadartasya Kim Aushadam. So on that thing, the diet medicines is actually not required. That is how even we do after cancer. It is normal after 2 months or might be how much of a time. We don't go for a longer time of medication. It will be with the diet. So that part, how we approach and how the diet charts are there, we will discuss the same.
Next section. And it is from my side, I think really wonderful you people are doing. Because just 2 months with all our medications and with the, especially with the diet is really what you are coming out, and you are building the Ayurveda in that level. It's actually inspiring. I think today's session is, and that actually many more of us are thinking towards only Ayurveda, that you have given the confidence to many Vaidyas over here. And congratulations, and yes, behalf of one and all, and thank you so much for being so honest and so much humble to be here with all your experience. I know you are busy with so many things. You are, because I am observing you, you are conducting so many events from Mahanasa. Hats off. Thank you so much.
Dr. Halama ma'am, you have question, I think.
Namaste, ma'am.
Namaste.
As I was searching regarding Swastasya Swastarakshanam, Swastarakshanam is the main part of Ayurveda. As I was searching, since from the beginning I was searching for this, now I got the opportunity to learn more from you people. I am very much interested to prevent the diseases rather than treating the diseases. So please guide me in future also. I will personally contact you people to get more, to know more about the diet plans. Thank you so much, and such a wonderful presentation from you people. And also, both are very youngsters. Definitely, we will definitely rule world with Ayurveda. Thank you. Thank you so much.
Okay.
Thank you once again, both
And
of
just,
you. Okay.
just a minute, be all RAAOUS team, please be on video. We'll take 2 minutes. We'll take one shot, including Archana madam and Rekha also. Please, like, we'll take one screenshot, and after that you can exit. Be quick, Annie, everyone, Shubhamangala ma'am, please, everyone, please be on video. Geeta, anyone have this? I don't know how to take in this laptop. So one can take videos. There's a screenshot of this thing. Geeta,
Yes, ma'am. Yes, ma'am. I'll take.
be on video. Only we. So many are from our team.
Kanchana, where are you?
Kalpana
Hello,
madam.
sir. Nagarjun, sir. Koti, sir.
Where sir is?
Ella sir.
Oh, namaste, sir.
Congratulations, sir.
Thank you.
For
Geeta, please take a screenshot. So I will stop recording.
yes, ma'am. Vishwanath, sir.